work ambulance in polyclinics, and то есть it's maybe consultation and not obligatory surgeon skills. Вот, поэтому тут вот поэтому разное. Но in any cases you should know this pathology too. Really, it meet often in a general medicine practice. And today, so we start from anatomy of the nose and paranasal sinuses. Так. Сасикумар. Нет, у нас Сахай. What's anatomy of the nose? First of all, we divided the nose on external and internal nose. External nose, it's the most prominent part of our face, yes, and it has the two parts, bony cartilages, bones.
Upper one-third is bony. Two-third is bony and lower one-third is cartilage.
What bones are composed the bony part?
Nasal bones.
Да, самое маленькое вы начали, from the small. It's a nasal bone.
And frontal processes.
Frontal processes of the maxilla. То же самое, да? And nasal processes of the frontal bone. То есть three bones are composed the base, можно сказать, да, bony part of the nose, external nose. And pay attention that the very near bones of the orbit. Cartilages part.
It has upper lateral cartilage, lower lateral cartilage. It also has lesser alar, which is a sesamoid which is also known as sesamoid cartilage, and the fourth one is the septal cartilage.
Да, и some parts of the septal cartilage also participate in a framework of the external nose. Да, вот. So the such framework, we understand that when you examine the nose, paying attention to the shape of the nose, and usually the shape change due to trauma, да, trauma, да.
Usually pyramidal in shape.
Да, правильно. Вот мы видим, да, что такая красивая pyramidal shape of the nose, and due to trauma, usually it may shift, да, to the one side, or has a S shape, C shape, и какой еще?
Like
Saddle nose, saddle nose, yes.
And sometimes it deviates also.
Да, or deviated, or absent, да, of some parts of the nose. И вот bodies between the bony and cartilage parts, it's a piriformis orifice. Да, помним? Piriformis orifice. But not only trauma may change the external nose. If you know that it's bones and cartilage, we also may think that it's some specific infection, да, which may affect bones and cartilages. Вот, это у вас в Индии такое есть, у нас, слава богу, нет, да. Но в Индии действительно, правильно вы сказали, что есть invasive fungal infection, which may affect, first of all, cartilage, да, more soft part of the nose, really, it may be. Так, значит, fungal infection, раз, what else? Да, правильно, конечно же, syphilis. Classical view of the syphilis, it's a patient, да, without cartilage part of the nose, да, and да, or today it's a saddle nose because affecting cartilage parts of the nasal septum. Да, saddle nose.
granulomatous condition.
Вот. И правильно вспомнили, да, что it's a different types of the granulomas. Значит, it may be vaginal granulomatosis, autoimmune, да, diseases. It may be eosinophilic granuloma, тоже eosinophilic filtration autoimmune diseases. And it may be, what else granuloma? Tuberculosis. Да, туберкулезис.
Lupus, leprosy.
Вот, lupus, lepra. Угу.
Склерома.
Склерома,
Склерома.
молодец, да, правильно. Склерома may change the external nose. Угу.
Склерома, склерома.
And some types of vasculitis. Да, vasculitis. Who may explain why the vasculitis affects cartilaginous part of the nose? Nose or ears? What's specificity of the cartilage?
More prominent blood supply there.
Конечно, of course, yes. Every cartilage, no, and in the nose, in the nasal septum, and yes, the same, has a perichondrium. Да, perichondrium, specific layers, which for nourishing, да, which has a lot of capillaries, but base of the cartilage, что? Haven't. Да, no blood supply, no capillaries. And nourishing performed due to penetration. Да, вот как раз таки on the body, да, of the some all need substance to the cartilage. And it's lead to the growth up, да, of the cartilage and leaving of the cartilage. In case of vasculitis, walls of the capillaries and small vessels became smaller and usually obstruct the microthrombosis. And cartilage,
Didn't get nourishment.
да, да, правильно. That's why sometimes and even nose may be involved, да, in autoimmune inflammation. And don't forget about it. Today it's, ну, можно сказать, epidemic, да, of allergic and autoimmune diseases. Значит, the change pathology in the population, and really we meet a lot of very rare diseases. Even when I was studying in a university, I never heard about them sometimes. But really it was very, very rare. But today, really, we meet the such patient, and sometimes really for their life even very important, diagnosed on time, and treatment change. Immunology has a very nice progress, and you also study it on a second course, yes? Or foreign student don't study?
Yes, ma'am,
Immunology.
we will study.
Yes,
Yes, ma'am.
yes. What maybe teacher said you that today it's a revolution, in a treatment of autoimmune, some allergic autoimmune diseases, even oncology diseases, because we may produce artificial antibody, to the some focus of pathological changes, inflammation, and today really we may help the such group of the patient, but on time, of course, on time, to prevent severe changes in organism. And quality of life, of course, because external nose, without external nose, it's very severe cosmetic defects. Reconstruction of the all external nose in patient with thrombosis of vessels, it's false process, the best method is a treatment correct on according stage of the process. Так, окей, значит, bony and cartilages part, and it's covering with the skin, skin. You know that skin usually has subcutaneous, cellulose. What about the nose?
Facial nerves supply to this.
Facial nerve.
Facial nerves.
Facial nerve.
It's branches of maxillary branches and.
Даже что еще есть? Что? Muscles. Да? Muscles of the nose. We may increase the space of the nostrils. Yes. И procerus muscles. Помните, тоже есть такая.
Basal membrane.
Да, base of
fibers
the.
and collagen fibers.
Да. But skin very thin, thin, especially above the
Bone area.
Bone area, yes. So that it's a fact for the doctor that small even scratching or trauma may reach bone. It may be a cause of osteomyelitis. So every damaging,
melting of the bones of the nose.
It also may change the shape of the nose.
Is it a bacterial infection through which
чаще всего,
osteomyelitis?
Of course. Usually it's a bacterial infection. And it comes deep. But from the other side, you can see that the external nose have a very intensive blood supply. Very intensive blood supply. Krishnananandu. What branches and what vessels have branches for the external nose? Yes, vessels. Now we stop on a vessel.
Transverse fascia.
First of all, you should say that it have blood supply from two big vessels.
External carotid artery, internal carotid artery.
And nose is the center of the face,
Yes, ma'am.
which is anastomosis between the external
And internal carotid artery.
So really, from the one side, healing of this zone, region, very quickly, very nice. But from the other side, any infections may spread easily, or to the nose, to the face, to the bones, to the cartilage, and even intracranially.
Yes, ma'am.
Почему? Вот branches. The biggest branches, it's a facial,
Facial
да,
arteries.
Then
branch,
transverse
да,
facial
and transversus. They are from
Transverse
maxillary,
maxillary,
да,
yes.
from the
Yes, ma'am.
maxillary. It's external carotid
Then infraorbital
Infraorbital,
arteries.
Но не
dorsalis
помню,
Then
помним, что есть
dorsalis
конечность.
Dorsalis
nasal,
nasal.
and
And artery of the
Supra-
supratrochlear.
trochlearis,
Supratrochlear
And
и
supraorbital.
angle artery. Да.
Yes, ma'am.
И вот уже they comes to the orbit, да, orbit artery, and orbit artery comes to the from the superior orbital fissure, куда? To the internal carotid artery.
Which ophthalmic branch,
Да, it's ophthalmic branch.
which is of ethmoidal.
Мгм. What about the vein?
Jugular vein.
Да,
Jugular
the
vein.
biggest, да,
Jugular
vein
vein.
which collects the blood from the face and external nose and internal nose. It's a jugular vein.
Jugular vein.
Да, in a normal condition, all blood comes down
Hmm.
to the jugular vein. What help to move the blood? Because there is no valve, да, on
Yes,
the
ma'am.
face veins.
Current that the air will be
Да, especially for the brain.
Yes,
Nasal
ma'am.
breathing, it's
Nasal
like
breathing.
pump, yes,
Yes, ma'am.
for sinuses. Or vein sinuses of the brain especially, yes. Так, what else?
The layer of the veins.
Smiling, да? All time
Movement.
say, please, in any stress and any situation, smiling.
Yes,
Because the
Blood
smile, да, initiate,
The blood circulation.
yes, blood circulation and contraction of, сколько там, 40 muscles
Muscles
of the face, да,
Yes,
да. And really vein, да, как бы inside of the muscles presence. It's also our mimic also help to move, да, the muscles in a correct position.
Hmm.
Еще что? Our gravitation, да, when we move and walk, usually it's also, помните, только румяные щелочки появляются, да? Oxygenation increase. Да, поэтому, да, movements of the body, sport, it's, да, and mimic, да, да, also help remove the blood from the brain, from the face to the jugular vein. No, it's a normal, but sometimes maybe inflammation, да, and obstruction. The some part, for example, the vein corresponds to the artery usually, and the name the same. Тоже facial vein, also transversus vein, also intratrochlear, dorsal nasal, ophthalmic, but ophthalmic vein connects with the
Ears.
Eyes.
нет.
Brain. The frontal part of the head, like
Да,
frontal
какая-то.
part of the
Ну,
head.
какая? What exactly? What structure?
Ma'am, forehead. Ophthalmic vein.
Cavernosus, plexus, sinus.
Cavernous.
Да?
Plexus.
Вот, где? Where is it? On a base,
Base.
да, of the skull. Да. Вот, here. Plexus cavernosus. It's a part of intracranial venous sinuses, yes, да? It's a collect also the venosus sign and then through the orbit да, drainage from the face to the jugular vein also, да. So we have the ready ways, retrograde ways for infections. The brain, да, from the face. And the name of this region, trigonum morbi, triangle of death. Remember from anatomy? It's a space on a face between facial vein. Between the facial vein. Да? Вот он, этот треугольник. Why we say about it? Because even the small inflammation may spread retrograde to the brain. Да, it may be cause of thrombosis of the cavernous sinus. It's initial stage. At the next progress of the inflammatory process, it's meningitis and sepsis. So really, it's a danger, really. And patient with this diagnosis usually hospitalized to the intensive care department. Yes, because in any time maybe stop of some vital function. And inflammatory of the brain, of the base of the skull, really it's a very dangerous. So your task also, paying attention to the first symptoms of inflammation in this region. First of all, it may be furuncle. Да, furuncle. Furuncle of the nose, of the nostrils, of the apex of the nose, or lips or cheek. Может быть. It may be first stage of the inflammation. And of course we should treat this furuncle and remember about complications of this furuncle. And if the patient complains and you reveal the focus of the inflammation, remember about thrombosis of the cavernous sinus. And remember the way of the vein. What symptom will be dangerous for the doctor in this case?
Difficulty in breathing.
Нет, этого не будет, слава богу. It's maybe only if the pathology start in a nasal cavity. Хотя это тоже может быть, да. For example, abscess of the nasal septum. Тогда будет, да.
Tumor also. Tumor.
Color, dollar, tumor,
Yes, ma'am.
function, железо, and what was the fifth?
Color, dollar, temper, function. Rubor.
Вот.
Redness.
Да, вот это все redness. It's
Redness.
you reveals in a place, origin of source of infection, inflammation, and understand that it's furuncle. But how you understand that it's complication, venous thrombosis? Алло?